Someone has a stroke every 40 seconds. It kills someone every 3.5 minutes. Seniors aren't being told this, though. Your restroom routine can be the unnoticed cause. 99% of seniors are unaware that basic habits like sitting for extended periods of time, urinating, or breathing while wiping can increase the risk of stroke by more than 300%. Yes, the location you frequent on a daily basis may be unknowingly raising your risk of stroke by 300%, particularly if you are over 65. Furthermore, most doctors never inquire about it. But for years, scientists have been raising the alarm. Blood pressure, arterial stiffness, brain oxygen, and other factors are impacted by these everyday habits. The 7 silent bathroom behaviors that could silently increase your risk of stroke by up to 300% are listed in this video, in order of least to most deadly. Stay there, since nearly all seniors engage in habit number 1 on a daily basis. However, this behavior alone can raise blood pressure by 90 millimeters of mercury. That would be sufficient to rupture a weak spot in your brain. According to recent research, it can cause a stroke in less than 10 minutes. Our team has conducted extensive scientific study to support every piece of information in this movie. Additionally, the description below has links to all of the references. This is not a guess. These are actual truths that have the power to transform your life. We have a question for you now. What was your breakfast this morning? In the comments, tell us about your hearty breakfast this morning. We'll review everything you say and respond with any additions or deletions. Every comment is being read and responded to. Without further ado, let's begin by discussing habit number 7 and the reasons it is gradually harming your brain each morning. The 7th is urinating quickly in the morning without completely emptying the bladder. Although it may seem innocuous, this is anything but. Incomplete bladder emptying can increase systolic blood pressure by up to 30 millimeters of mercury, a direct stroke risk amplifier, according to a study published in the International Urogynecology Journal. This is what's taking place. When your bladder is not completely emptied, your body stays in a minor fight-or-flight response. The sympathetic nervous system is triggered by it. This reduces oxygen delivery to the brain, tightens arteries, and maintains high blood pressure. This raises the risk of stroke and plaque rupture over time. The worst part is still to come. The detrusor muscle, which aids in pushing urine out of the bladder, declines by over 50% in seniors over 65. This implies that you are most likely not finished, even if you believe you are. Retention of urine can develop subtly. According to the European Urology Review, post-void leftover urine is frequent in older persons, but rarely observed until problems arise. However, how is that related to stroke? Everything. Chronic retention increases renin-angiotensin activity, which raises blood pressure and speeds up arterial aging because it makes the kidneys work harder. Unbeknownst to you, your body practically enters a pressure storm every morning. Here's how to make it better. Take your time. Wait 10 seconds after urinating, then try again. It can lower bladder pressure by as much as 60%, according to the National Institute on Aging. See your doctor about alpha blockers if you're a man with an enlarged prostate. They ease the muscles in the bladder. Pelvic floor therapy is beneficial for women, particularly following menopause or childbirth. The 6th is cleaning your teeth just once a day, or not at all at night. Doesn't that sound unrelated? However, science disagrees. One of the most dangerous areas for a stroke to start is your mouth, and it occurs in silence. Seniors who only brushed once a day had a 70% higher risk of stroke than those who brushed twice a day, according to research from the University of South Carolina. The risk of missing a night brush alone is nearly doubled. This is what's taking place. Plaque accumulates overnight if you don't brush at night. Bacteria that are present in plaque do not remain in your mouth. Through microscopic wounds in your gums, they enter your bloodstream, particularly if you have periodontitis or gingivitis, which affect more than 50% of persons over 65. The germs cause inflammation in your arteries once they're inside. Your blood becomes thicker, stickier, and more prone to clot as a result of that inflammation. Additionally, the leading cause of ischemic strokes is clots. This goes beyond theory. Even after adjusting for age, blood pressure, and smoking, a 2019 study published in Stroke, the official journal of the American Heart Association, revealed that those with gum disease had a twofold increased risk of having a stroke. The power of oral bacteria is that great. Endothelial dysfunction is the term for the disorder where they enter the bloodstream and literally attack the artery lining. Your brain's lining serves as its first line of defense, and blood clots can quickly form if it is damaged. Why is this more important in the restroom then? Because most individuals don't realize how important brushing technique, frequency, and timing are. The 8 hours of bacterial growth that occur while you sleep are not addressed by the one brushing that most seniors perform each day, usually in the morning. Your saliva production decreases at night, providing germs with the ideal environment. Brushing should be done before bed, not just in the morning, and you should use light pressure with a soft, bristled toothbrush. Brushing too vigorously might cause further gum wounds and provide bacteria with a direct route to your arteries. Here's a surprise, too. It also affects what toothpaste you use. According to the Journal of Periodontal Research, stannous fluoride toothpaste decreased C-reactive protein and other stroke-related inflammatory markers by more than 40% in older persons. That's enormous. Changing to an anti-gingivitis paste prescribed by your dentist may have consequences that extend beyond your gums. Additionally, don't neglect the tongue. Overnight, thick coats are formed by bacterial colonies. Don't only use your brush, use a tongue scraper. A Japanese study on oral hygiene in older persons found that it eliminates up to 78% more volatile sulfur compounds than brushing alone. Additionally, floss. It is not a choice. The Centers for Disease Control and Prevention report that regular flossing reduces the risk of stroke in seniors by 24%. The reason for this is that flossing eliminates the precise plaque that allows bacteria to enter your bloodstream. Consider it this way. Would you push bacteria into a cut on your skin on a daily basis? That is the result of not flossing. The fifth is going to the bathroom first thing in the morning while dehydrated. This kills silently. The science is horrifying, but most seniors are unaware of the risks of urinating immediately after waking up, without first drinking anything. Your body is at its most dehydrated point of the day when you wake up. To force that sludge-like blood through constricted veins, your heart is working harder, your arteries are tighter, and your blood is thicker. You're in for a catastrophe when you combine straining while urinating. Dehydration is a major factor in the over 80% rise in stroke risk that occurs in the early morning hours, according to a study published in The Lancet. You lose water during the night through perspiration, respiration, and urination. Your blood volume decreases, and if you have to use the restroom quickly before rehydrating, the abrupt position change, low blood volume, and straining all contribute to a potentially fatal decrease in cerebral perfusion. This indicates insufficient blood flow to the brain, which can lead to a severe ischemic stroke in elderly people who already have plaque or artery stenosis. That's not all, though. Researchers at the University of Tokyo have found that dehydration in the morning can cause a 30% increase in platelet aggregation. In other words, your blood clots more quickly, and clots lead to strokes. As a result, your heart, brain, and blood vessels are under tremendous strain when you wake up, stutter to the bathroom, and then push out urine when your body is dry. The worst part is about to happen. Elderly people frequently have a diminished thirst reflex. This implies that even when you are in dire need of water, your body does not strongly encourage you to drink it. Your body is dehydrated even if you may not feel it. This explains why strokes among elderly persons occur so frequently in the morning. It isn't merely a coincidence. It's a bad morning habit. Here's an alternative. Drink at least 300 to 500 milliliters of water before you even get out of bed. Keep a bottle or glass by your bed. It should be the first thing that you do. This eliminates abrupt decreases in brain perfusion when standing and instantly increases blood viscosity. According to research published in the American Journal of Clinical Nutrition, drinking water before getting up lowers orthostatic hypotension. Up to 61% of persons over 65 are at risk for falls and strokes. Additionally, it's a warning sign if you have dizziness when urinating in the morning. There is not enough oxygen reaching your brain. Take a seat on the toilet, relax, take calm breaths, and don't strain. It's not simply aging if you ever experience a narrowing of your vision or ringing in your ears after standing or urinating. It's a warning sign for stroke. Taking lengthy, hot showers in the morning without cooling down is number 4. It sounds reassuring. A long, hot shower to start the day and ease tense joints. However, this practice may be raising your risk of stroke in unexpected ways if you're a senior, particularly if you're omitting the last cool down. The science is here. Your blood vessels widen as a result of fast vasodilation brought on by hot showers. Your blood pressure quickly lowers as a result. The effect is significantly more severe if you are currently using blood pressure medication. Seniors who were exposed to hot water for just 15 minutes experienced a drop in systolic blood pressure of more than 20 millimeters of mercury, according to a study published in the Journal of Applied Physiology. Before you comprehend what happens after you exit the hot shower and enter cooler air, that type of drop might seem nice. Suddenly, your blood vessels narrow once more. This rebound, known as vasoconstriction, causes your blood pressure to rise again. It's chaotic now, though. Your body is attempting to simultaneously balance pressure and temperature. Additionally, your likelihood of causing a clot increases significantly if there is any artery narrowing or plaque accumulation during that chaos. Indeed, a 2015 study conducted in Finland discovered that individuals, particularly those over 65, who frequently took long, hot showers without cooling down, were twice as likely to experience early morning strokes. Why? Because your blood vessels are under more stress due to the abrupt changes in temperature and the sharp fluctuations in pressure. This stress can cause plaques to come loose or weak places in artery walls to burst. It's similar to shaking a cracked soda can. It gets worse when something breaks eventually. Sweating is caused by hot water, but since it evaporates in the bathroom, you might not notice. Your blood may become thicker, and your risk of a clot may increase as a result of that covert perspiration. Your arteries are in a state of turmoil before you even leave the house, when you combine it with the vasodilation and constriction cycle. So, how can it be fixed? You must finish with 30 seconds of cool or lukewarm water, but you are not required to miss the shower. This facilitates the adjustment to room temperature, controls blood pressure, and stabilizes your blood vessels. This easy cool down lowers the risk of falls, stroke, and post-shower dizziness in seniors by more than 50%, citing research published in Temperature, Austin. Additionally, don't stand motionless for extended periods of time under the water. Blood pools in your legs as a result, which reduces blood flow to your brain. If you feel even a little dizzy, keep moving slowly, move your feet, and always sit down on a shower bench or ledge. The third is straining when passing gas. This one is surprisingly common and lethal. Chronic constipation affects more than 40% of seniors over 65, and many of them struggle just to pass feces. The harsh reality is that straining when using the restroom might literally burst a blood artery in your brain, in addition to raising blood pressure. Intense straining during bowel movements raises the risk of intracerebral hemorrhage by more than 300%, according to a groundbreaking study published in Stroke, the American Heart Association's official journal. That is the most serious type of stroke, a bleeding stroke. Why? Because the Valsalva maneuver is triggered when you press too hard. At that point, you bear down and hold your breath, much like you would while lifting a large object. Blood pressure spikes sharply as a result, occasionally rising by more than 50 millimeters of mercury in a matter of seconds. The body can withstand that increase in a healthy young person. However, that unexpected rupture can be disastrous for elderly people with plaque accumulation or tight arteries. A vessel wall can rupture with just one little weak point. The harm is immediate. The issue doesn't stop there, though. No warning, no second opportunity. Additionally, strain raises intracranial pressure. This indicates that when you use the restroom, the pressure inside your head increases. It doesn't take years for the perfect storm to form when combined with an increase in blood pressure and a decrease in oxygen flow. It may occur in just one episode. This habit is considerably more harmful because of this. The majority of elderly people sit on a typical high toilet, which actually goes against the way your body is made. Your colon is kinked when your knees are at a 90-degree angle. You have to strain to pass stool because of this. However, your colon straightens out when you elevate your feet in a squat or footstool position. Pushing is less necessary as a result. Hydration is essential to resolving this. Drink between 1.5 and 2 liters of water every day. Because they soften stool, include foods high in fiber, such as prunes, oats, or chia seeds. According to University of Iowa research, prunes can increase bowel regularity by as much as 60%. Additionally, movement is important. Gut motility is increased by a quick 10-minute morning walk. Your intestines use the wave-like action to move food through them. You need to push less the more it moves. Additionally, refrain from spending a lot of time sitting on the toilet. It raises your chance of hemorrhoids and tells your brain to relax when you're under a lot of pressure. Enter, take care of yourself, and exit. To ensure that you don't miss any more videos like this, please hit the bell symbol, subscribe, and like the video if you have enjoyed it thus far. The second is scrolling through your phone while spending too much time on the restroom. Most likely, you have. Everybody has. You take your phone into the restroom, check the news, respond to messages, and browse a little. However, this behavior isn't harmless for elders. It's risky. It discreetly raises your chance of stroke in a number of ways. This is the reason. First, prolonged periods of inactivity cause your brain's blood flow to decrease. This is particularly true when using the restroom while seated or squatting. Venous return slows down when your lower abdomen is squeezed and your knees are bent. That indicates improper circulation of blood from your lower body. Brain perfusion decreases, and blood pools in the legs. According to a study that was published in Neuroepidemiology, cerebral blood flow can drop by up to 17% in persons over 60 who sat still for more than 15 minutes. That is a significant decrease. To avoid vascular damage and clot formation, your brain needs constant blood flow and oxygen. And the risk of stroke increases rapidly when flow decreases. The danger increases when you factor in the straining and posture problems we discussed before. There's more, though. The phone itself is problematic. Why? Since scrolling causes the so-called sympathetic nervous system to get activated, your stress response then starts. The brain interprets screen light and input as stimulation, even if you're reading something simple. This can induce blood pressure spikes, tighten blood vessels, and increase heart rate, especially in older persons who already have cardiovascular diseases. According to a 2020 study published in Frontiers in Psychology, seniors' systolic blood pressure and pulse rate increased by up to 15% after just 10 minutes of phone browsing. Therefore, by sitting still and preventing blood flow to the brain, you are simultaneously increasing internal pressure through mental stimulation. That combination is lethal. Things worsen. When glancing at their phones on the toilet, most individuals cock their heads sharply downward. The vertebral arteries, two important blood veins that supply blood directly to the brainstem and cerebellum, are compressed in that position. These regions regulate respiration, heart rate, and balance, among other essential processes. You're literally squeezing blood to those areas if you tilt your head too far for an extended period of time. Additionally, you are preparing for a silent strike if those vessels are already constricted due to age or plaque. You've sat for too long, increased your blood pressure while decreasing blood flow, and then stood up too quickly. Add in the fact that seniors frequently have orthostatic hypotension, which is a sharp drop in blood pressure when standing. Scrolling on the toilet is the first step in the stroke cocktail. How can one break the habit then? First, don't use your phone in the restroom. Don't negotiate it. There should be no distractions in your bathroom. If required, set a timer. You've already exceeded the safe limit if you're in there for more than 5 to 7 minutes. Second, pay attention to your posture. Keep your neck straight and sit up straight. Use eye-level printed materials if you must read anything. Don't read at all, though. Now is the moment to get rid of, not to participate. Third, follow up. After using the restroom, take a 2 to 3 minute walk. This normalizes pressure, boosts brain oxygen, and resets circulation. According to an age and aging study, seniors who took a little stroll after sitting had a 30% lower risk of stroke. Lastly, pay attention to your body. Leg tingling, dizziness, or blurred vision after standing are not minor symptoms. They are warning signs. Don't disregard them. The first is holding your breath while standing up fast or straining. Almost every senior does this one without realizing it, and it's deadly quick. You're having trouble staying balanced, or you're getting out of the toilet. You brace and hold your breath, but that movement alone sets off a hazardous series of events within your body. Additionally, it can cause a deadly brain event in seconds for elderly people. The Valsalva maneuver is the name of it. That's what happens when you hold your breath or bear down during exertion, according to medical terminology. Although it's normal, it's really dangerous, particularly in the restroom. Holding your breath causes pressure to build up inside your chest. The pressure instantly decreases the amount of blood that returns to your heart, hence lowering cardiac output. The oxygen your brain requires is then denied. Your body then abruptly recovers, overcompensates, and your blood pressure skyrockets. Holding your breath while exerting yourself can result in a systolic blood pressure spike of up to 90 millimeters of mercury, according to a study published in Clinical Cardiology. It's instantaneous. It is like to setting off a grenade within your arteries. Additionally, a weak vessel wall, plaque, or constriction may be ruptured by that pressure explosion. In just a few seconds, a stroke begins. Let's now examine rapidly standing up. The majority of seniors experience a dip in blood pressure as soon as they stand, particularly those who have orthostatic hypotension. Holding your breath, standing up fast, and straining all at once sets off all the stroke triggers at once, which is something your body requires time to adjust to. Low oxygen levels, high blood pressure, and confusion all strike your brain. At that point, arteries break or clots form. The risk of stroke-related collapse or vascular injury is 2.5 times higher for older persons who frequently rise up too abruptly from seated postures, particularly while using the restroom, according to the British Journal of General Practice. What makes this number one is the mix of breath holding and positional pressure changes. It occurs daily and is the ideal storm. However, nobody discusses this section. As they age, most seniors' respiratory capacities deteriorate. They hold their breath more frequently without even realizing it because their lungs stiffen and their diaphragm weakens. It becomes into a reflex whether you're wiping, reaching, straining, or standing. However, it is not innocuous. It is lethal. So, how can it be fixed? Retrain your breathing first. As you stand, practice letting out your breath slowly. Avoid holding and bracing. Before you move, take a deep breath, and as you exert yourself, release it gradually. This keeps oxygen flowing to your brain and lowers internal pressure. Second, slow down. Get out of the toilet gradually. After sitting, pause. Your hands should be on your thighs. As you stand, exhale. Put a grab bar to use if necessary. Seniors who stand slowly and breathe appropriately can lower their risk of stroke by more than 60%, according to the American Stroke Association. That is enormous. Third, maintain your awareness. Pause and restart if you find yourself holding your breath while using the restroom. If necessary, return to your seat. Avoid pushing through visual blackouts or dizziness. Your brain is yelling for oxygen at that moment. Lastly, think about assistive technology. A toilet frame, a safety rail, or an elevated toilet seat can make a big impact. You are more inclined to brace and hold your breath if your muscles are weak. Reducing strain lessens the need to clench. Finally, have a look at your prescriptions. You're especially more vulnerable if you take diuretics or blood pressure medications. Because of this, your baseline pressure is lowered, resulting in more severe spikes and decreases. If you have experienced any fainting, dizziness, or headaches after using the restroom, consult your physician. Those are warning signs. Because it occurs daily, habit number 1 is the most important. It is automatic, invisible, and lethal. Silent pressure is created by habits like holding your breath, getting up quickly, and speeding through bathroom duties. Then one day, it strikes, and it strikes with force. Although these 7 behaviors might not seem like much, they pile up for seniors. Your body approaches a critical threshold with each one, and when it does, a stroke occurs. No mercy, no warning, but you have some authority. You can alter the future of your brain by altering your restroom habits. First, drink plenty of water, breathe steadily, calm down, clean wisely, and move mindfully. These are not merely personal hygiene practices. After 65, you realize that these routines are life or death. Let us ask you this. Have you ever experienced lightheadedness, vertigo, or a bathroom blackout? Tell us in the comments section below. Someone else might benefit from your story. Please remember to like this video if it was helpful. Give it to a loved one over 60. And sign up for more health advice supported by science that nobody else is discussing. Even in the restroom, your brain deserves to be protected. Please feel free to leave a comment below if you have any queries or would like to share your personal experiences.